Hospitals throughout West Michigan are reporting much higher than usual visits to the emergency rooms these days, and it is all centers on concerns about the flu, especially H1N1. How do you know when you should be visiting the emergency room? In the newsroom right now, talking about this with Dr. Michael Olgren from St. Mary's. Thank you for joining us.
Thank you.
What kind of an increase are you seeing in the emergency room right now?
Well, we're having about 30 to 60 extra patients per day with flu-like symptoms at St. Mary's.
So that's quite an increase. Are you guys making room, extra room for them, or how do you handle that? Is it just waiting longer in the waiting room, or do you have more people sort of responding?
Well, we just built a new emergency department, so we do have some capacity from that perspective. Also, many of the patients with the flu are able to be treated very quickly. A lot of people are looking for reassurance, and so we've been able to keep up.
So along those lines, are people just scared? Is that what you're seeing? Do you think they need to be there? How many out of a day, I should say, of the people that come in with flu-like symptoms really need to be going to the hospital?
Well, there are some that probably could be taken care of in other places, either at their doctor's office or some even at home. The American College of Emergency Physicians just came out with some guidelines on their website as directing people as to whether they need to come to the emergency department or not.
Okay, so let's talk a little bit about those symptoms. When do you need to go to the emergency room?
Well, in general, we ask people to think first, do they have a fever and a cough?
Okay.
And if they do, then the next thing to look at is how bad are the symptoms. If somebody's having breathing problems, if they're breathing fast or having a hard time breathing, that would be one reason to go to the emergency department. If they're vomiting, can't keep food down, that's another reason, or liquids, and they're getting dehydrated, if they're dizzy when they stand up, or if they're confused. Those are all reasons that people should come to the emergency department to be evaluated.
What is your advice to parents who are simply concerned about the safety of their kids with H1N1 right now? They want to just make sure. They need that peace of mind. What do you say to them?
Well, as long as the child's keeping fluids down, you can give Tylenol for fever reduction, and that will help the child to stay okay. If the parent's not sure, they can always bring them to the emergency department for evaluation.
Okay.
The CDC at cdc.gov has good guidelines for parents.
Okay. Dr. Michael Olgren from St. Mary's, thank you for your thoughts. We appreciate that.
Thank you.
Back to you.